C3D receptor. تمام؟ هذا الريسبتور primarily موجود وين؟ على البي سيل. تمام. هلا بنحكي عنها. So it has an envelope, a pigment, a capsid, and a core. This is your double-strand DNA virus. This is Epstein-Barr virus. لما نحكي على Epstein-Barr virus, in our culture is not as much. But and I always believe إنه دائما بيكون في stigma أو pathognomonic thing إنه إحنا بنفكر إنه مرض مش منتشر. مثل النيموسيستس كارينياي أو جوفرسياي. هذا إحنا بنحكي عنه كثير. And مرضى الإيدز اللي عندهم CD4 count less than 200. تمام, people die from it. But when it comes to this virus, it does have a worldwide distribution, and I believe personally it's more disseminated or more present than what we believe in. Direct contact, and it's usually asymptomatic, and it's also known as kissing disease. تمام? It is ubiquitous. The transmission of Epstein-Barr virus موجود بشكل كبير. As we all agreed at one point, we do swim in an ocean of microbes, and then we agreed that these microbes are primarily composed of these other metabolically inactive particles اللي سميناهم viruses. Okay. However, the key feature لما واحد يحكي Epstein-Barr virus, in Western society, لما نحكي Epstein-Barr virus, what comes to mind? Teenagers who go to college and live in the dorms, in their culture, in their setting. That's when the person-to-person transmission becomes at peak. تمام؟ شو مشكلة هذا الفيروس؟ It's a viral infection, مثل any other viral infection. مشكلته إنه it does have this latency. It does have that dormancy that can be portrayed as a chronic, and then has a lot of malignant inclinations to enhance or to initiate metaplastic changes. فهون بيجي الانترست to studying Epstein-Barr virus more than others. Okay. Transmission with prevention, obviously. Now. salivary infection الابيثيليال cells اللي عليهم التروبيك ريسبتور اللي اتفقنا عليه اللي هو C3D. So these are salivary infected epithelial cells. شو في كمان شيء interesting كمان الفيروس also infects اللي هو naive resting B cells. هذول النايف resting B cells موجودات بالتونسلز. تمام؟ هسه بفرجيكم الصورة والجراف and how does this interact with each other. But we are to familiarize ourselves with the nuclear antigen, the latent proteins, and the membrane proteins. هذول إلهم correlation أو importance for the diagnosis, وإلهم correlation or importance for the metaplastic changes أو inclinity to become more cancerous. كويس؟ هلا I'll actually outline it for you. But for now, we know this is kissing disease. We know it has to do with the salivary epithelial cells. We know إنها إيش منتشر بشكل كبير جدا. And we also know that it also targets an interesting component of your immune system, naive resting B cells in the tonsils. But this is how much we know about this double-stranded DNA virus up to this point. But if we were to dissect through the various components, nuclear one and the lipid proteins, establishing and maintaining the infection. So EPNA1 and LPSs, let's check, establishes and maintains the infection. So this is important. And this is even more important. EPNA2 is interesting for immortalization. شو يعني؟ هلا بنشرح شو يعني. And LPs are membrane with an oncoprotein-like activity. The three statements are extremely important to understand for the disease outcome, for its eventual outcome. The eventual outcome, replication in the B cells and the epithelial cells. هذا بسموه ايش؟ replicative. هذا اللي انت بتعرفه. طيب إذا ما صار replicative, what could also become latent تمام يعني stays dormant مثل الهربس إذا بدك with the zoster with the shingles مظبوط stays latent in the memory B cells and it could stimulate and immortalize in B cells. Once that occurs, the third phase of the infection. This has the cancer inclination part. 3 routes or 3 replicative, non-replicative, and then cancer producing a part, the whole immortalization. تمام؟ طيب. Oropharyngeal epithelial, short receptor, the tropism tower, the C3Bs, and then the B cells, the naive resting B cells and the tonsils. Okay, so all the IG, M, A, and G are involved. Interestingly, في واحد منهم is associated with the pole panel antigen test اللي هو يعني كثير مشهور اللي بيشتغل فيروس بنعمله للكولج كيدز كثير اللي الهيتروتروفيل antibody agglutination with force RBC بيعطيني ايش positive reaction and thereby this person had an active بيشتغل virus infection. Others such as the early antigen, the capsid antigen, and the membrane antigen. وراح افرجيكم table to delineate or to outline the disease and its spread. So let us go through this first. تمام؟ البشتان virus حكينا this is kissing disease transmit through the salivary epithelial cells من شخص إلى آخر. Peaks, primes, asymptomatic موجود in kids موجود in elderly but peaks and primes around college age years it goes to the oropharyngeal epithelial cells and that's your age replicative. ماشي؟ So this is our first cycle here if you follow my cursor. Right. Then it goes into 2 routes. The infective of the naive B cells, the tonsils, and this infection can go into 2 different manifestations, whether it's lytic or dormant. وفي كلا الحالتين, whether it's lytic infection or dormancy, يعني immortalizing these B cells, in both cases you're looking at a lymph and a blood involvement. And hence we are coming to the disease, اللي شو اسمه? Infection mononucleosis, fever, pharyngitis, and lymphadenopathy. Fever, meningitis, and lymphadenopathy. You are looking at all the other symptoms as well. بس اللي بيجيني college kid with fever, pharyngitis, and lymphadenopathy. وين الليمف اللي هون برأيك وين بتكون؟ cervical صح؟ posterior ولا anterior؟ posterior. And then it goes anterior. Starts with the posterior, بعدين بتروح على anterior. So here is your kissing disease with the clinical feature, the diagnosis, and the management. خلصتي ولا بعدك؟ طيب غاصت بين الجماهير. شو ممكن نعالج او شو ممكن نعمل هيتروتروفيل الاي جي ام على الهورس او sheep RBCs if it agglutinates then that's a positive. What can you do? Not much حقيقة supportive. You can only hope for the best in this case. إذا صار immortalization للT cells then this person will run the risk of ايش؟ of cancer unfortunately. طيب. Good. So this is infectious mononucleosis. شو قصة lymphocytes in this case and the enlarged spleen and the tonsillar exudates. I guess you understand this one. To a various degree we understand the spleen. But what is this one? شو اسمها lymphocyte? Duffy? Or downy cell. This is atypical. I think there is an image. طيب. The diagnosis زي ما حكينا infectious mononucleosis 1 to 4 weeks with this presentation is enough to establish that this guy is suffering from IM. 30% of the atypical lymphocytes بيجوا على downy cells. تمام؟ monospot test or ball panel heterophil antibody IgM اللي هسه حكينا عليه for the diagnosis. Well, the immunity is lifetime. Looking at this image, مهم for pathology perspective, مهم for the hemopoietic lymphatic system perspective, and for your exam. You're looking, you're seeing what? A lot of RBC, صح? And you're looking, you're seeing some normal lymph nodes, and you're also looking and seeing this rather unusually large with irregular border cell. شو سمينا هذول cells? These are characteristic or pathognomonic from a pathology point of view. The diagnosis of infectious mononucleosis caused by Epstein-Barr virus. كويس؟ So far so good. حكينا كثير معلومات so far. حكينا على disease and pathogenesis, molecular aspects, so various antigens. Okay? So this is your replicative cycle, this is your non-replicative cycle, and this is your early marker for the lymphocyte cycle. Now, if you get to be asked, and then 3 or 4 scenarios in this case, for the disease or the infection, whether or not you do have the IgM, or the IgG, or the early antigen, or the nuclear antigen. Okay? إذا بتلاحظوا, if you do have the early antigen, then it ought to be acute or chronic infection. Now, to separate or to distinguish the two, similar for the IgG by the way, if you see these two, they are present in both acute and chronic. مظبوط؟ الدistinction وين بتصير؟ The IgM, which is obviously present in the acute and is not in the primary. تمام؟ Past infection, on the other hand, نشوف النيوكلير والIgG only. طيب, what about susceptible? Nothing. Susceptible. College student. واضح التابل؟ يعني I guess this is the two important distinction, and this one gives you the lifelong immunity past infection if you do have the nuclear antigen or the IgG. تمام? Again, there are more of the downy cells as we've discussed before. These are your atypical lymphocytes, and you can do a monospot. يعني بالامتحان monospot is enough to establish a diagnosis of IM in the lab. Or a Paul Bennett t-test for the heterophil IgM antibody. The mean, it binds or agglutinates with any foreign, such as horse or sheep red blood cell. And that's the story of Epstein-Barr virus. The story كانت replicative أو latency. بعدين حكينا على شغلة هيك على السريع, قلنا the immortalizing of the B cells. And how does this connect with malignancy? It's a fifth of all human cancers worldwide are caused by infectious agents, يعني aka oncogene, and there are many يعني زي ما تحكوا multi-step process or hypothesis. هذا السلايد مش عن الإبشتاين-بار فيروس. This is in general. Integration, insertion, and mutagenesis, DNA damage, cellular processes, dysregulation, and evasion of host immune strategies. These 4 categories here fits all infectious, primarily viruses and so forth, that fits the bill for why cancers occur in an association with human papillomavirus, for example. Cervical cancer. Epstein-Barr virus with Hodgkin, lymphoma, and others that we'll be discussing here in a minute. But this is to further enhance your understanding of the molecular mechanisms of how actually carcinogenesis takes place as a result of an infection. But what's interesting about Epstein-Barr virus إنه بتروح immortalization of the B cells beyond chronicity to the degree that causes cancer. Where is the Epstein-Barr virus in this case? Burkitt's lymphoma and nasopharyngeal carcinoma. If we go through it, it's a DNA, Burkitt's carcinoma, the B cell lymphocytes and the epithelial cells, and there is an infectious agent, and these are all the oncoproteins. NA1, NA2, LP1, LP2, these 4 oncoproteins, هدول ايش؟ These are virus proteins. مظبوط؟ And here we are looking at them as oncoproteins. Proteins that will plug into these 4 various processes that enhances the likelihood of cancer development. The rest of the table مش معنيين فيها انتوا اليوم. Okay? We are only معنيين في these 4 oncoproteins. واضح؟ اليوم are connected to the Epstein-Barr virus pertaining the B lymphocytes and the epithelial cells of the nasopharynx, leading to Burkitt's lymphoma, the lymph nodes, and nasopharyngeal carcinoma as such. تمام? And here is some explanation على EBNase and the LBM1, the lytic and the latent, and how does it connect to form cancer. First tumor of the viruses, Burkitt's and nasopharyngeal carcinoma. ما بدي تعرفوا أكثر من هيك حقيقة. That's good enough. ماخذين Hodgkin's lymphoma, Hodgkin, Burkitt's, ماخذين هاي الأمور. طيب. Nasopharyngeal carcinoma and leukoplakia, especially among people with HIV/AIDS. Okay. Epstein-Barr virus is association with Burkitt's lymphoma. Unfortunately, the association of Burkitt's lymphoma in Africa والنيزوفارينجيال carcinoma وين شايفينه؟ شو هاي المنطقة؟ Far Asia مظبوط؟ يقال بأنه in Far Asia there is another correlation with nitrate containing food products in addition to the Epstein-Barr virus that enhances and يعني مثل شو بيستخدم النيتريت بالأكل؟ إيش بنحط؟ اللحوم المصنعة أحسنت. So sausages, hot dogs, preserved meats, تمام؟ But this is more predominant in these areas مع الرامنز مع النودلز, it has an interesting twist there. In terms of the incidence, we can look and see a demarked incidence for Burkitt's and nasopharyngeal carcinoma. Both are connected to Epstein-Barr virus. So this is the story of infectious mononucleosis kissing disease. حكينا على tropism, حكينا على attachment, حكينا على C3b receptor, حكينا على various components of the viruses. تمام؟ ننتبه للenvelope, the proteins, and how do they correlate to 3 possible outcomes for Epstein-Barr virus, whether it's replicative, not replicative, or immortalizing the B cells, the manifestation of the disease itself, the diagnosis of the disease, and obviously there is little prevention can be done for Epstein-Barr virus, simply because of its widespread. تمام؟ حكينا على carcinogenesis at the end. And these are the important medically relevant aspects to the disease. Right. Parvovirus B19 is our last piece for the day. Reservoir is the respiratory tract. It targets, interestingly, the immature erythroid progenitor cells, وخاصة in those with sickle cell anemia. But Parvovirus B19 له كثير interesting correlation. طبعا له 5th disease, one name, erythema infectiosum or slab cheek. Literally, if you look it up and look up some images, تمام, you can see a lot of correlation or clinical evidence for slab cheek Parvovirus B19. تمام? Parvovirus B19. شو اللي بخوف Parvovirus B19? Association with sickle cell anemia. Anemia, congestive heart failure, and sometimes hydrops and abortion. Okay? Clues: school-age child with fever and indurated rash, 5th disease. Pregnant women, similarly, with hydrops fetalis or spontaneous abortion. So that's the clinical image of Parvovirus B19 and the interesting association with sickle cell anemia. Okay? And with this we conclude our microbiology part. Any question على Epstein or Parvovirus B19? Okay.